Now we'll be going ahead with our panel discussion 5, which talks about empowering patient, the role of digital health in enhancing patient engagement and health literacy. In this session, we will talk about how to explore digital health tools, applications, and platforms can empower individuals to actively participate in their healthcare journey. Discuss the impact of the patient engagement or treatment, adherence outcomes, and overall wellness. Address the role of health literacy in the digital age, focusing on making health information accessible, understandable, and actionable for diverse population. Now, I would like to invite our moderator, Dr. Jaseet Singh, Vice President Ujala Cygnus Group of Hospital. Welcome, sir.
Thank you so much, Alicia. So, the best part of this today's scenario is that we are talking about the digitalization, and digitalization is the basically I usually say the word digitalization is the key. So, I would like to thank the World DiGiHealth Forum and the team. So, in for this wonderful session. So, I would like to welcome our three speakers, Dr. Vishal Gandhi, welcome, Dr. Anuj Prakash, and Dr. K. Madan Gopal. So when we talk about digitalization, so digitalization is basically talks about the technology, talks about the information and the communication tools. And these basically when we are going in the health field, so all the tools variables that we are using, and these actually helps the patients with a better outcome and the quality of services that we are providing and the betterment of the life. So first we will start with the Dr. Anuj. He is the HOD and the senior consultant biochemistry, Medanta Hospital, and he has around 19 years of experience in his healthcare and the pharma field. Hi, sir. Welcome
Thank,
to this forum.
thank you.
So, please share your experience in terms of digitalization and the healthcare sector, which you feel is more relevant for this topic. Thank you.
Thank you, Dr. Jasdeep, and thank you for giving me this platform to speak on this topic of digital health. So, just to start with, I would say that the healthcare landscape is undergoing a significant, I would say, tectonic shift towards patient-centric care, where the patients are being the central role. I mean, they are the individual which play a central or more active role in managing their health. And digital health technologies are actually emerging as a powerful tool to empower patients, enhance their engagement, and improve the health literacy. And this is what is the topic we are discussing in this panel discussion. So, so I would say that, so for me, if I'd say there are three basic challenges in our traditional healthcare system, where the accessibility was the first one, where still till this year or till this day, we are still not able to get our healthcare to our remote corners of the country. It is still limited to our metros or tier one cities. So accessibility is one such issue with the traditional model. Second would be engagement, where I would say that the patients were treated as more of a passive listeners in our engagement. So there was a lot of passive information dissemination was happening, where it was not a sort of active engagement from both the patient side. And third was, I would say, communication. There was very limited consultation time with the clinicians. You know that there's hardly any time to interact with clinicians, and this unidirectional communication channels which hinder the effective healthcare between patients and healthcare providers. So these are three major challenges which I think could be overcome by having digital health because of our information access. You can have a lot of mobile apps, online resources, patient portals, which provide accessibility, multilingual languages, and customizable information. which caters to the various learning style and literacy levels. Second would be active management by using wearables, for example, symptom trackers, medication reminders, which enable patients to monitor their health, set goals, and track progress. And third is improved communication by having, let's say, telemedicine platforms, secure messaging services, online communities. So all of these three, I mean, so this is my opening remark in this for this panel discussion.
Thank you so much, Dr. Nuj. I think Dr. Madan is also joined. I think your sir, your mic and the camera is off. So if you can just turn it on. So we will go ahead with our next speaker, Dr. Vishal. So he's a good friend and colleague also. Dr. Vishal is the founder and CEO of Biorex Venture Advisors Private Limited, an investment banking firm started in the year 2012. Dr. Gandhi has a overall 24 years plus of extensive experience in the various aspects of investment, mergers, acquisitions, and portfolio management and the due diligence. Vishal has been involved in many first M&A deals in digital healthcare, diagnostics, hospital and pharmaceutical space in India. Prior to Biorex, Dr. Gandhi has also held top and mid management positions in the Yes Bank. Welcome, Dr. Vishal. So what will be your opinion? What is your opinion in all this? How have digital health platforms and mobile applications contributed to enhancing patient engagement and self-management of chronic diseases? So, what is your opinion on that?
Sure. Thank you, organizers, for inviting me to be a part of this wonderful opportunity. And thank you, Jasjeet, for taking up the role as a moderator. And I know the toughest role that today, you got to play. And when you have luminaries like Dr. Anuj and Dr. Khetrapal and Dr. Madan, talking, and who has seen the length and breadth of the healthcare. So I think before I get to the chronic management of healthcare, I think we need to probably see that how India was before digital health started, right? India has actually been more of a sick care market than a healthcare. So it's only because we had, technology which has actually allowed the consumerization of healthcare. And that is where today we can truly call ourselves as a healthcare country, not as a sick care country, because otherwise everything was aligned sick care. And so coming to, four aspects of healthcare, delivering healthcare to 1.4 billion people in the country, I think it's a very, very monumental task. Like no private players, no public players can play. It has to be a private-public partnership. And in that dimension, I think one of the key focus for most of these healthcare organizations is to really provide accountable, affordable, and accessible healthcare. And I think if you have to look at these three pillars, providing healthcare seamlessly to 1.4 billion people, the only way it can happen is to actually through digital. And so digital has actually allowed us to get the data on a real-time basis, and thereby we can manage not just the acute conditions that we suffer from, but also the chronic condition. And I think there's enough which one can talk about, diabetes to respiratory to all that. And we have seen that how people have been able to take care of take care of their health, provided they have the variables, they have the remote patient monitoring apps and all that. So doctor is really empowered to take a right decision and what the right medication and the right regimen, because there is a data feedback, and based on the data feedback, there is a kind of individualized treatment which has begun, and that should actually work the best and, like I would say, efficacious. And so this is what actually digital health has enabled. And we have seen like companies like Fitterfly, we have seen companies like Health Impetus, which actually I sold to a Dabur family business called Healthcare at Home. So we have seen that if you develop a healthcare as a model, and if you keep chronic as a segment, it's quite lucrative even from the finance point of view, because being a finance guy, I can't stop myself talking about return on investment. So I think it's important for us to see that the return on investment is generated to an extent that actually justifies to attract investment, right? The investment will be only attracted where actually one can make money. And I think in B2C, one of the constant challenges that we have seen from an investment perspective is that there's a cash burn. While if you are able to take care of the chronic segment, there the cash burn is very limited. because the patient is already enrolled, and now it's about what is called LTV, overtime value across the length of the breadth of the patient. So I think a lot of things which we could not have imagined under the no technology, under no digital health, we are able to imagine. And people, there's another very interesting paradigm that I keep talking about is 80-20. Now, people from even, remote village of Rajasthan, or maybe remote village of Assam, can still connect to a best doctor in AIMS, which actually was not the possibility. So I think this 80-20, which will take some time to solve in terms of the infrastructure, because 80% people live in those areas where there's very limited accessibility to the good doctors, because good doctors don't want to go work there because there is no actually market. Why should they be deprived? All right. And so telemedicine, I think Dr. Prakash highlighted in his earlier context that telemedicine has actually allowed things to be, much more impactful. And today doctors can, treat patients even sitting in tier 3, tier 4. We have seen enough cases across all the therapy segments, starting from dermatology to gastrology to many more segments, which we would not have imagined. And again, there's a concept of robotics coming in. So I think digital health has become like an integral part of the overall healthcare continuum. And if we were to talk about healthcare continuum, it's very difficult to imagine life without a digital health. So this is my opening remarks, and I'm sure you will give us an opportunity to talk more, as our panel goes, right, Jasjeet?
Yeah, sure, please. So now I will again come back to Dr. Anuj, and so what is your views on how a healthcare provider and an institution can work together so that there can be a better patient centricity approach and a better quality work they can do in terms of the digital health platforms?
Uh, Yeah, so basically, this is about engagement of patients into the uh, uh, digital phenomena of healthcare. So
Hello.
I would say the health literacy is something which is very, very key aspect in this particular area.
जी बोलिए.
So basically, as I said, there is a gap which
Hello.
we said digital health would definitely be able to bridge that gap between the haves and have-nots. But how do we get there? The only way I would see is a health literacy, the digital health literacy. And so the basically from a medical perspective, I would say that there is a lot of complex medical terminology and jargon which they sometimes fail to understand. So, and various patients come from various diverse cultural backgrounds, and even the language barrier is there between many such cases. So we can have a lot of educational resources in multiple formats. For example, the text formats, video formats, audio formats, and in the languages of the local languages, utilizing clear visuals and infographics to understand those difficult terminologies. We can also offer interactive tools flow for exploring medical test results or such medical terms, which can enhance their understanding. We can also have joint educational initiatives and training programs for healthcare professionals on communicating effectively with patients. And we can have a lot of community collaborations. We can have small where the medical fraternity can reach out to their communities, and they can have a lot of dialogue between such to promote health literacy. So basically, I personally feel that this way the patients can better understand their health needs, their test results, their medical needs. They can ask a lot of informed questions and make informed decisions regarding their health. And and obviously, if they are able to follow or adhere to these actions, it can lead to improved health outcomes. These are my thoughts.
Yeah, thank you. Thank you so much. And I think Dr. Madan Gopal has also joined with us. Welcome, sir, for this energetic and session that we are conducting today. And so let me got the opportunity to introduce you, sir. So Dr. Madan Gopal is a highly experienced healthcare professional with over 30 years of experience in health system reforms and strengthening of India. His expertise played a crucial role in implementing the RSBY Swasthya Bima Yojana, and one of the world's largest health insurance scheme as well, that is Ayushman Bharat PMJY. During his tenure as a senior consultant at National Institute for Transforming in India, Niti Aayog, Dr. Gopal provided essential support for various health sector reforms and policy level initiatives, including Ayushman Bharat PMJY, NDHM, and the ongoing COVID 19 pandemic responses. Currently serving as the advisor for public health administration at NHSRC, Ministry of Health and Family Welfare, Government of India. Please welcome, sir, and kindly share your journey and your work experience and how previously the health sector is working and now the health sector has transformed into. Please.
Oh, thank you, Jasjeet. It's very interesting. I was listening to my previous speakers, though there was some technical glitch regarding the muting and unmuting of my mic and the video. In fact, I was the first person to join. So I was there online at
Yeah,
2:45,
yes, yes, sir.
but no issues. But nevertheless, we should be having a standby for your technological glitches.
Yes.
Having said this, the digital journey in the country, I have seen this journey since the early part of this century, that is 2001-2, when the initial thing started with the telemedicine things, and the district hospital used to get connected with the medical colleges, and most of the district, they wanted to have a telemedicine center so that they can have a air condition and a computer. That was the whole paradigm which we used to have in during that days. Now, having said this, things have changed. The major game change happened after the enactment of the Clinical Establishment Act in 2011, which mandated to have electronic medical records. Though only 11, 12 states they have adopted it, but at least it has shown a way that the electronic medical records are going to stay. That's one thing. But since health is a state subject and the center is putting money, it has ensured that some assurance has been given that they will be providing some set of services. As a result, a lot of information management system has crept in. That means it has evolved. If you talk about the disease, you are having an integrated disease surveillance program. If you talk about the RCH services, you are having a RCH portal. If you talk about malaria, you are having malaria portal. You talk about tuberculosis, you are having a TB portal. That's the way how the system evolved. That means digital information has stayed. It has come in, and we are using the digital information for informed policy decisions. That kind of shift has happened over the last many years. Apart from that, when we were struggling, when the PMJ program, when the RSPY program, Rashtriya Swasthya Bima Yojana program, was a success, and looking at the success, we thought that we should be enhancing the coverage, and that has been rolled as a PMJ program, Pradhan Mantri Jan Arogya Yojana. So later on, the names and other thing changes, but this program was rolled out. When this program was rolling out, at that time we struggled that how to have a unified kind of thing. That means so many softwares are there. You name a problem, and you are having an app for that. At that time, in 2017, the discussion was that can't we have a single identifier so that all these portals and other things which have evolved over the years, they can talk to each other. So as a result, what has happened, discussion started, and we came up, when I was in Niti Aayog, we came up with a national health stack. That means all the portals would be having in a stack, and through a common identifier, they can be talking to each other. All the information can be culled out and they can talk to each other. With this kind of notion, a lot of deliberations and other things happened, and the National Digital Blueprint evolved, which was subsequently rolled out as a Ayushman Bharat National Digital Health Mission, ABDHM, which we are calling it as. It was rolled out like that. It evolved like this to have a common identifier. What presently we are doing is we are trying to create a common identifier. That means we are trying to give a number to a person, to a provider, to an institution, to a pharmacy, so that the same thing can be embedded into the patient records, so that the what I've told earlier, that the electronic medical record was envisaged in the system, so that all this information is embedded into the records, and that record can be used for improving the services, evidence-based planning, as well as the providing other insights for either for research, for policy, for improving the provisioning of the services. In this way, the system has evolved and it has changed. Now, whole efforts is there to create an ID, embed that ID into the records so that these records can be used. Other aspect is in other direction which we are moving, because the uptake of this thing is very important. If you have embedded these IDs into the record, that records can be used for developing algorithms which can be run into this AI mode and the machine learning boards, and blockchain and other things can be utilized. Because prime and most important thing is the records. So we are in the process of creating electronic medical records after embedding the ABHA IDs as well as the other IDs of the providers in this thing. This has evolved. Now you see that increasingly the government is depending on data-driven governance, because we are using the data which is generated by the digital tools for coming up that for making any sense in which direction the services are moving, in which direction the disease is moving, and what is the burden of disease, what kind of uptake is there. That kind of things are evolving. And private sector is also not left behind. They're also devising ways and means and ways of seeing that how they increasingly utilize the data which is generated in the hospitals. Presently, they are generating the data in the hospitals, and they are using it judicially for arriving at conclusions and taking informed decisions. So you see the potential utility of this. We have to see that how both the systems merged together. They both start using the ABHA IDs and other things. That's the work is in progress. That means slowly we are moving in direction. So I will stop here with my initial remarks. Then I can take further questions later on.
Thank you. Thank you so much, Dr. Madan. I have seen that time also, sir, when the government has started the Ayushman Bharat scheme, and we are the basically Ujala Sickness is the first hospital in the Haryana state that is empaneled under that scheme. That is in the year 2018. And after that, we have seen there are many Ayushman Bharat 1.0, 2.0, 3.0. Even in the, if we're talking about the digital health platforms, they are TMS 1.0. Then recently they have launched the TMS 2.0 also. So the government is also pushing each and every way to enhance the digital health platforms. Next, I would like to ask from Dr. Vishal. Please tell me a few details about the wearables that the patient is using, and how that is helping the better outcome and the better patient-related information, and that is helping the patient for a better life, basically, they are having. Please.
Thank you. So I can only say that I'm also using one wearable, which is Samsung Watch, and it has really allowed me to manage my health better. And there can't be a other wonderful example than your own health. And I've seen that, because there is a feedback mechanism, as I mentioned earlier, we are able to at least see that, how many steps we have done, what kind of exercises, when we should be doing exercises. So I think there are many variables, but to me, I think one can only wear one variable, and they can be multiple features. They can be integrated, like one of the companies that we have supported called NowZone, and so they've developed a wearable which is worn on the torso, and there you monitor the breath rate. Now, it's very difficult for us to wear multiple variables, right? So I think the integration of those APIs and those technologies into one smartwatch will be a big game changer. And I feel that wearable as an industry has gone ahead. And we have seen a wonderful example of a company called Dozy, wherein their mission is that her bed Dozy. So Jasdeep, I'm not sure what journey are you at, but what the kind of revolution Dozy has brought, what is called remote patient monitoring, is a clear indication that it is not about wearable. It is actually about, tracking the entire parameters, through the command center, and which actually makes the whole healthcare ecosystem, at least in the private world, very accountable and accessible. And so that way, I think it's very inclusive. And the role of wearable technologies, remote patient monitoring is very, very profound. And it will be very difficult to imagine a world without such technologies. And I think more we get integrated to one variable, it will be better for us to actually manage our own health. And I think one of the previous panelists was talking about preventive health. Now, preventive health is something which is I would say, the core to the healthcare today. Now, we cannot really depend upon government. We cannot really depend upon insurance, because today, the private hospitals are run by insurance companies. No, we don't pay, any of the guys, right? It's an insurance which pays. Now, even for insurance to track and give you an incentive, whether, your risk premium should go up or it should go down, you've got to have a data. Now, how do you track this data? And I think this is where, we are going to be seeing incentivization of such technologies adoption, and how it is going to create a further more consumerization of healthcare. I think healthcare has two dimensions. One is preventive, which I think is going to be really a center stage. And if that happens, I'm sure we will become, a developed country, because all the money will not go for healthcare. It will actually go towards the development which is required in logistics, transport, and other sectors, which are going to be really pillars of taking Indian economy to actually a developed economy. And I think lesser money we spend on healthcare, the better it is, because we will not be able to, spend that money considering where we are. And so I think managing one's health through wearable is the very, very important aspect of our life. And I think every government must come up with this kind of mechanism. Insurance has come up with it. There's another very interesting company in Bombay, which does a lot of work with the pharma companies. They call it B2B, patient engagement. And but I think insurance can only play a certain role, whereas an individual or doctors or, whatever, I think all the stakeholders of healthcare have to play a very, very critical role to ensure that there is an adoption of such technologies, and those technologies eventually will have a very long-term impact, in managing your own health. And I think even patients, definitely don't want to be called patient. They want to be called consumer of healthcare today, right? And I think that is where, I would love to leave. If you have any other additional points to ask, I'll be happy to respond.
Yeah, sure, please. So I think while continuing this, I would like to ask Dr. Anuj. So what do you think? Is this cost effective for the hospital or the patient, or how this digitalization of each and everything will help the benefit and the institutes?
Okay, so before coming to it, I think let me just want to add few more points to Dr. Vishal, because he touched upon preventive healthcare. So preventive is something is a key in the healthcare segment. Actually, the word is going from illness to wellness, or what we call the prevention. We always used to say in the past that the preventive healthcare is the most important segment, because that's the key. So we have to catch people at a younger stage before they fall sick, and so we have a lot of such variables and monitors. For example, just to tell, there's something called continuous blood glucose monitoring, where which is actually a very game changer in the management of diabetes. So similar such examples are coming. Similarly, for other cardiac things, there are a lot of variables are coming. So we have to. So preventive is definitely the key for the future healthcare. Now, coming back to the question of the financials of digital healthcare. So initially, we always think that the digital healthcare is financial is a barrier. What people think initially, but if you see in the larger context, where those hospitals or those institutions which have adopted digital healthcare or digitalization of their systems, they have proved to be very, very cost effective and economical in the long run. For example, if I'll tell you the example of, let's say, medical records section or MRD department, where in earlier days it was like a very cumbersome department, where all the records were in a hard copy format. But once the institution started investing into the technology of keeping the records in a digital format, the space has been saved. A lot of other saving has been done to the institution. Paper has been saved. In fact, in my previous organization, we did a small study of about paperless hospital. we have gone paperless because of adoption of digital technology, and there were a lot of saving in the context of our papers. So if you put all of these things in the perspective, you will see that you actually end up saving a lot of money when you adopt technology in your day-to-day practice.
Thank you. Thank you so much. You have, Dr. Nuj have added a very good point. And now I will be coming to the Dr. Madan. So, what is your opinion? How this digitalization, the all the health sector has reached to the rural level, to the ground level patients and the hospitals, those who are working in the tier 2 and tier 3 market? What is your opinion on that? And how the government or the private sector can help these patients and the hospitals so that that can be reached to the ground level?
Jasjit, yeah, it's good that you have put this question, because if you look at the uptake of the digital IDs, Aadhaar IDs, so the uptake is it's not that significant in the private sector, because we have to see that how, because we are using variables. In a bet, all the parameters are there. Has it been embedded into a ID, then obviously the behavior and the other things during subsequent visits or subsequent thing that can be analyzed if it is linked to that, linked to the record. That's one area that which is not happening. Apart from that, if you look at the way things are being, we are trying to embed this Aadhaar IDs into the electronic records at the population level. Population level means at the 3,000, 5,000 population, 3,000 to 5,000, we have a Ayushman Arogya Mandirs, which were erstwhile sub-health centers, where we are screening the population as well as generating Aadhaar IDs. After screening the population, we are creating the digital records in which Aadhaar IDs are getting embedded. Even in the immunization also, we are creating an Aadhaar IDs and linking that record with the immunization profile of that. That means we are trying to create an electronic record at that level. That's one thing. Second thing is, if you look at the internet penetration in the country, is more than 60%. The smartphone penetration is more or less more than 60%. If you talk about the 2G internet, is more than 90%. If the broadband is limited, but 2G is more than 90%. That means feature phones are more or less available everywhere. And what we are trying to do is we are trying to gather information through these smartphones and the feature. You might have heard about the accredited social health activists, who are the health workers, who are in all the villages. Around 10 lakh, a million of ASHA workers are there in all the villages. They are being equipped with a smartphone, Android-based smartphone. In some of the places, they are having tablets. They collect information from the people, and that is fed into the system. In the system analyzes that. So we have gone up to that extent. The government has gone to that extent, and we are capturing the information from the ASHAs, right from the village level. Apart from that, we are using that same platform, because if you look at the eSanjeevani teleconsultation platform, as I mentioned that the Ayushman Arogya Mandir, they are the peripheral most health institutions. From there, doctor to doctor consultations are happening. And you'll be happy to know that more than 10 crore consultations have happened over the last 2-3 years. And every day, so many consultations happens. That means doctor to doctor consultation in the public sector, they are happening. But if you look at the number of institutions which are there, if you talk about the tier 2, tier 3, and the other cities, this kind of mechanism is there, and that is working very effectively. You can't say that it would be 100%, it can match the standards of the peripheral level apex private sector. No. But when many of the things which can be handled at that level, they have been handled at that level through various means. That is, telemedicine is one of the things. And it is yielding results also. It is reducing the load on the district hospital and everything. Up to the district level, it's only the public system which are more or less. Once it comes to a tertiary level care, then the other role of other institutions come. But essentially, the question which you have asked, how much penetration we have already penetrated into the lower level. If you look at the way the IC activities and the awareness related activities happen, in the awareness also, we are using the Android phones and small clips. The reels are being made for propagating IEC activities. So you're also utilizing the same things. Apart from that, if you come further upwards, we are trying to see that how a clinical decision system, the support system is enabled to the auxiliary nurse midwife, the health worker, male and female, who are more or less the act as a doctor at the peripheral most level. You see that this kind of digitalization of the system has happened. And apart from getting information, we are training them also. Whatever new methods, whatever new training guidelines, or whatever uh, new advances are happening, which are related to the public health system, that is immediately being propagated through our iGot platform and the learning management system which we have evolved. So immediately, the moment any module is maintained, the medical officers right up to a PSC level. PSC is at the 20,000, 30,000 population. At that level, the information percolates, and so that the transmission loss which used to happen earlier through the cascade mode of training, that is also been avoided. That means right from building capacities, getting information, as well as supporting them with a decision. That is all getting inbuilt into this. That means work is in progress in that direction. We see that how the system evolves and gets mature in the coming days.
Right, sir. Right, absolutely right. So I think my question justifies this one is the best answer I have got. And there is one question from the audiences. I think Dr. Anuj would like to answer. What feature or tool are available to help patients track their progress, set reminders, and stay motivated in managing the health goals? Dr. Anuj.
Yeah, Dr. Jasjeet, as I said, there are a lot of mobile apps which the users can download. For example, there is a app called MyFitnessPal. It is a very popular app for tracking nutrition, exercise, and weight goals. So there is something called Fitbit. You all must be using. I mean, I was using. Then there's the Apple Health. There's Google Fit. So a lot of such are available. There are a lot of free also available. A lot of the Android phones have Google Fit, and Apple Watch users can also use their Apple Health app, so which tracks your steps, calories, and such. You can do exercise routines, all those water reminders. So all of these are available nowadays. So, and in fact, these apps also have something called gamification. They give you rewards, they give you benefits if you do that much steps, that much activities. So those are the things which you can use. Apart from it, you can have what is that? The wearables. Again, there are watches like Samsung Galaxy Watch. What I think Dr. Vishal has just shown us, which is like very advanced in that context. So if some people wants to purchase or to invest in their health, they can go for these gadgets. They are really helpful. And what else? So these are, then there are, okay, there are something called a lot of personalized coaches, which comes with the watches. For example, the Garmin and other such watches, they also have their advisors, which tracks they take your history, they advise you about your diet and all that. So all these things are available nowadays, which comes in packages. So if you explore it, you will get it. So I don't see a problem in that.
Thank you so much, Dr. Anuj, and I hope our audiences are satisfied with the answer. And now I will be going back to Dr. Vishal. So you are basically from the finance background, and you have a very good expertise in the due diligence part and the other parts also. So what is your opinion, or what is your opinion where you can push these startups to go in the digital health platforms and start doing all the works where the digital and the health sector are coming at one place, and they are basically starting their business in the health sector? What is your opinion, and would you recommend or not?
Yeah, absolutely. So, I think digital health is a great enabler. And we see that, because of digital health, we can address what has not been addressed so far. I think from an investment point of view, there are, I would say, more than 1,000 companies which have been angel invested or venture-backed companies in the area of digital health in India itself. Some of them have also died down. Very few could scale up. So I think there are certain challenges that needs to be addressed to be able to attract the investment, and one could be around the security of the data. The second is that, even our own portal of Abha, if you look at, there are 135 service providers registered, and even big wigs are there, and they've not been able to induce the people to go for personal health record or electronic health record. So I think there has to be an incentivization. As I said, there has to be a clarity on the regulation, the data treatment, the safety of a data. There's so much of cyber security challenges which are coming up. So I think these all needs to be fixed up. Otherwise, data could be misused, and at the end of the day, I think it's a personal data, right? No pharma company or no company that way for the commercial motive should be allowed to create a business model around it, right? And your previous question about what are the features or tools which are available to manage patients, track their progress. So I think very wonderfully captured by Dr. Anuj. I just want to supplement a couple of points. So there is a very interesting startup that we are supporting called DoseTap. So they actually help patients to do something called medicine tracking, right? Because people after 60, they tend to forget whether they have had their medicine regimen properly or not, and they have no idea, and they sometimes, they don't have anybody to take care of them. And so how remotely, their relatives can actually figure it out. So this is one approach I can share. The other is Goki. Goki is very interesting, digital health company, which has raised about close to $20 million, and it's a B2C company, and they also work with a lot of pharma companies to be able to manage the health of the individuals through the B2B channel. Then we have seen AR, VR, which is also, like I would say, emerging for the rehab purpose primarily. Like, wherever there's a physiotherapy required, there are tools now which are through the augmented reality. You can actually manage your health at home. So, which is again a very, very important step, I think, which we would not have imagined if digital health was not there. So, to me, I think digital health continues to be a very interesting subject of investment, and every week we get to see one investment. We personally have also invested in about 15 plus companies in digital health. What basic challenge we have figured it out is that scaling up is still a big challenge, because it has to be entrenched into the healthcare ecosystem, and it itself is taking time to digest, right? Even the big companies like Dozy, who's sitting with tons of money, but they still are probably at not even 1% of the total beds that the country has today. Now, how does Dozy capture 10% of the private beds? I think is going to be, I would say, a big challenge. But I think having the clear need and having a clear economic business model, because I think adoption comes from economic business model. And I think Dr. Anuj also spoke about that, how ROIs in a paperless hospital is much better than a normal hospital which is still working on the paper mode, right? So I think there is a clear enough case studies which talks about that if you spend money on digitization, how it creates ROI. Then I'm sure, Jasjeet, your own hospital is also adopting something called electronic health record, and how it is actually helping you to go back and communicate and engage with the patient, because that is what has actually allowed us to unlock. Otherwise, there would hardly be a tertiary hospital reaching out to the patient saying that, this is your appointment time, please come on time, this is your electronic health record. Today, it's like so great, it's totally democratization. And I would again go back to my famous line that, we are in a very interesting phase of consumerization of healthcare, where, healthcare actors which did not play a role earlier, but today they are playing a role, and which is actually nothing but our own self, right? And so this is an empowerment, and this is how truly we'll all become empowered and to be able to create value for the country. Our GDP should grow only when we take care of our health. And I think this is where
Right.
I want to stop, right?
Absolutely, absolutely right, Dr. Gandhi. So from illness to wellness and from patient to consumer, we are now coming to the end of this session. So any closing remarks from Dr. Anuj, please.
No, Dr. Jasjeet, I think what the whole idea of this conference was to have the understanding of from illness to wellness and from patient care to bring the patient care into the center of the all of our activities. I think is the core objective and core phenomena, and how to reach to the patients to make them to so that they take care of their health as a most important subject, and which in long run prove to be good for the country, as Dr. Vishal has mentioned. So I think if
Thank
we're
you.
able to achieve that objective with this or with this sort of conference, I think it would be a great step.
Thank you. Thank you so much. And Dr. Madan Gopal, please
So
share your
one
closing
thing I want
remarks.
to add to your illness to wellness, to from wellness to well-being, because we are focusing on well-being. Because illness to wellness is all institution based. So well-being means we have to see that how a holistic way we promote health.
Right, sir. Thank you so much. Dr. Vishal, you have
I think
30
I've said
seconds.
enough. Only one point I would like, since Dr. Madan is here and he's a policy maker. So I think there's enough happening on the senior care. And I feel that the next opportunity for all of us to actually contribute socially and economically would be to focus on senior care, because today we are the having a demographic dividend of the youngest population. But what is going to happen after 15 years is going to be actually liability, no more demographic dividend. And I'm sure Dr. Madan Gopal and his team is already looking at it to create a connected world where, like we are able to manage our health very significantly at a very low cost, leveraging the power of technology. And I think this is where government has to play a very important role. And Dr. Madan Gopal is, I'm sure he's already thinking on that
Sure.
direction.
Sure. Thank you. Thank you so much, Dr. Madan, Dr. Anuj, Dr. Vishal. And the platform is all yours to Alicia. Thank you. Thank you so much.
Thank you, panelists, for sharing your insights.